receptor. This receptor lines the epithelium of our respiratory tract. Okay. Now, the SARS-CoV-2 has spike. Okay, abbreviation of the spike is TMPRSS2 spikes. I'm not gonna give you guys the full name. Don't worry about the full name. Okay. That's how it attaches. So the way that the CDC classifies the illness is into mild, severe, and critical. Okay. Mild is when patients do not have dyspnea. Severe presentation is characterized by dyspnea. It can even cause shock and multi-organ. I'm sorry, severe is dyspnea and people who have respiratory rate more than 30 and hypoxia. Do you guys know what hypoxia is?
No.
What is hypoxia? Anybody?
Decreased oxygen.
Yep, decreased oxygen. Very good. Critical is when there is respiratory failure. Okay, this is why they put people in the ventilator in the beginning, because they could not breathe anymore because of respiratory failure. Okay, but we figured out that ventilators are actually bad. Okay, risk factors for getting infected with this is close contact with somebody who has a confirmed case of the COVID-19 and recent history, traveling to a area that has a high incidence rate. Okay. Transmission is person-to-person transmission, mainly through respiratory droplets. So for example, somebody coughs, somebody sneezes, and you're close to them, less than 6 feet. That causes the virus to basically reach your mucous membranes. Okay, and then once it reaches your mucous membrane, it starts to attach and then starts to replicate. That's why we want people to be, far away from each other, 6 feet. We always say 6 feet. Okay. Now, experiments have actually been done, which so far it has shown that the virus can actually still remain viable in the aerosolized droplets for about 3 hours, which means that when a person sneezes, coughs, let's say on a surface like fomites, okay, surfaces, it can still live on these surfaces. Depending on what they are, it can live on there for a certain period of hours. And then a person who touches the surface with their hands and then they play with their face, like with their nose or their mouth, now it can also be transmitted once a person touches their eyes, nose, and mouth and starts to replication. Okay. That's why this is the reason why we always use hand sanitizers or wash our hands whenever we go out. So that way, in case you went to Walmart and you touched some item and somebody sneezed on it, you want to sanitize your hand because it can live in your hands even there for 3 hours before you touch anything in your face. And that's when it can attach. So you can kill it before it does that. Okay. Other mechanisms of transmission right now, we think it can also be airborne. We don't know. Okay, airborne is different. This is where it can actually travel in the air for long distances, but we don't know that for sure. Okay, now, as far as prognosis, which type of people have a unfavorable prognosis, or which type of people are more likely to develop the severe disease? Old people, specifically those older than 65 years old, and anybody that basically has any comorbidities, for example, like hypertension, diabetes, cardiovascular disease, COPD, emphysema. Also, people who are obese with a BMI of more than 30. Okay, so now this is here showing you guys the name of the virus disease. Remember, the genome, it's an RNA virus. The coronavirus is spelled with the R letter. That's how you can remember it's a RNA virus. This is the picture showing you the spikes, showing you how it's enveloped. Okay, it has a crown-like appearance on the microscope, as you guys can see. That's why we call it the coronavirus, because it resembles a crown. Okay, this is just pictures to help you remember, guys, the different characteristics of the coronavirus. This is just what is the name for this. We already went over this. And what does it cause? I already told you guys how it's spread. These are just pictures. They're very good for studying. So let me do this case study. I want you guys to tell me what you guys think. Okay. Yeah, I am. This I'm gonna post it. I tried to post it, but I couldn't. So you have case one: a 70-year-old male patient with past medical history of hypertension and diabetes presents to the urgent care clinic complaining of difficulty breathing. Vital signs show high fever. He recently traveled to China 1 week ago. Do we suspect COVID-19 in this patient? What do you guys think?
Yes.
Very good. Very good. What about case two? You have, why do you suspect, by the way, coronavirus? Why? Travel. Very good. What else?
Age and symptoms.
Age and symptoms. Well, age, I would say, and symptoms. Very good. And previous medical history, past medical history, abbreviated with PMH, a previous medical history. Very good, very good. Excellent, excellent. Next one, you have a 22-year-old female patient presents to the urgent care clinic complaining of sneezing, sniffling, and a dry cough. The patient denies any recent travel. The patient also denies contact with a COVID patient in the past 14 days. No past medical history. Do you suspect COVID in this patient, COVID-19? No. Very good. Very good. Very good. Very good. This is a picture. Tissue tropism. It destroys and attaches to angiotensin II receptors. This is the angiotensin II receptor on our lung cells.